We are continuing our focus on health on the show today. Specifically, right now, we are going to focus on ovarian cancer and the racial disparities that happen within individuals who get ovarian cancer. Let's find out more.
Here with me today is a physician and patient to discuss racial disparities in ovarian cancer risk assessment and offer potential solutions for minimizing these gaps. Speaking with Dr. Elena Ratner, she is Associate Professor of Obstetrics, Gynecology, and Reproductive Sciences at Yale University School of Medicine and a board-certified gynecological oncologist specializing in ovarian malignancies, as well as Shantana Hazel. She's a health advocate and founder of Sister Role. Thank you, both of you, for joining us today.
Thank you so much for having us, Christine.
So, Dr. Ratner, what are the biggest obstacles you face when trying to diagnose ovarian cancer?
Christine, so ovarian cancer remains unacceptably deadly. Part of this is due to delayed detection. Unfortunately, most of these cancers are still diagnosed in stage 3 and stage 4, and it has to do with a few reasons. One is symptoms. The symptoms of ovarian cancer are very vague. Symptoms like bowel symptoms, bladder symptoms, some bloating, some weight gain. But you can hear that these are also symptoms that a lot of women just feel naturally, especially during the time of menopause. So because of that, many women do not present to the providers till later in the course, and that's why the cancers are diagnosed later. We used to say ovarian cancer is a cancer that whispers. We actually no longer think that's the case. We just think that this is the cancer that nobody's really listening to. But the second reason is that even when they do present to the providers, we don't have great tests to diagnose these cancers early. Traditionally, we use the combination of an ultrasound and a tumor marker called CA125 to try to detect these cancers. We have known for a long time that this is not a great combination, that the tumor marker has a lot of false positives, a lot of false negatives. But recently, we have also found out that this tumor marker in particularly is not good for women of color. Women of color have, in general, lower levels of CA125. So to use it as a marker of whether the tumor is malignant or benign is just challenging. So that's why I'm so grateful that there's now research and there's now companies who are investing so much time and effort into providing us with other tumor marker tests and better tests with better sensitivity for all women, but especially for women of color.
And how do you suggest everyday practicing physicians confront racial disparities in ovarian cancer detection?
So, Christine, I think the most important thing is just awareness and acknowledgement and experience and knowing about it. I think a lot of providers actually do not know this information. And this racial disparity with early detection is just one of the examples. African-American women unfortunately get more aggressive cancers. Unfortunately, their care after diagnosis is also suboptimal and also allows for improvement. So it's very important that providers are very aware, not just of symptoms and signs of ovarian cancer, that they listen to women, that they make sure that they don't miss anything, that they make sure they don't turn the woman away, just telling her that it's normal. But also, it is so important that these providers also know about this racial disparity so that they strive every day to provide better personalized care for all women.
And doctor, what can be done to improve detection and survival for Black women?
Acknowledgement and then accountability for every single woman that crosses your door. Knowing that there's differences in how these cancers can be treated. We know that if African-American women after diagnosis are actually referred to experts in the field, surgical experts who do the surgeries, and if they receive their care at care centers that have experience with these cancers, that these women do better. So it really goes all the way from awareness and educating of patients, and then listening to the patients, and then checking the better tests and finding cancers earlier, and then treating them in a personalized, more effective, more optimal way.
And Shantana, other than disparities in risk assessment tests, are there other reasons why Black women may not receive more accurate diagnosis and treatment?
Yes, Christine, there's actually a few reasons why, and I'll give you a couple of them. Number one is social economics, the social economic group, and also number two, the the lack of care, the lack of proper care that we receive as Black women. Those are part of the disparities, and also not being heard. We go into our physicians' offices and our bodies. We're going through different things, but our voices aren't being heard. We're not being invited to be a part of the care plan, and we're being dismissed. And so, if we can start combating some of those issues, we would actually be answering the call to the solution for health disparities in Black women.
And how do you suggest Black women confront racial disparities in healthcare?
Advocating, and that's where I come in. For over 10 years, I've been an advocate for women's health care, teaching women how to advocate for themselves, how to use their voices, and how to teach them to listen to their bodies. When something is happening, don't dismiss it, don't brush it off. Bring it to your physicians. If the physician doesn't listen, it's time to find another physician. And let's hold each other accountable for this whole process and becoming overall healthy in our well-being and a better quality of life. In order to do that, we have to build a partnership with our physicians to actually piece the puzzles together.
Well, thank you so much, Dr. Ratner and Shantana Hazel, for joining us today with this important discussion about racial disparities in ovarian cancer.
Thank you, Christine.
Thank you.